the editorial. In effect, while the legislation would enhance access to insurance, the trade-off would be an accelerated crisis of healthcare costs and a perpetuation of the current dysfunctional system. Now, with many more participants, this will make an eventual solution even more difficult. Ultimately, our capacity to innovate and develop new therapies would suffer most of all. Now, that sentence in and of itself is, in my mind, enough to absolutely put this bill off the table. And I want to repeat the sentence. Ultimately, our capacity to innovate and develop new therapies would suffer most of all. In other words, what the United States has always been known for, innovation, entrepreneurial spirit, the development of new products and new services, would disappear. Now, that's not surprising when you contrast UPS or FedEx to the post office. Where does innovation take place? It takes place at FedEx and UPS. It does not take place at the US Post Office. There are important lessons to be learned from recent experience with reform in Massachusetts. Here, insurance mandates similar to those proposed in the federal legislation succeeded in expanding coverage, but despite initial predictions, increased total spending. A special commission on the healthcare payment system recently declared that the Massachusetts healthcare payment system must be changed over the next 5 years, most likely to one involving capitated payments instead of traditional fee-for-service. Capitation means that newly created organizations of physicians and other healthcare providers will be given a limited dollars per patient for all of their care, allowing for shared savings if spending is below the targets. Now, that's all Dean speak for we're going to restrict, we're going to ration healthcare. That's what that sentence actually means. If you read between the lines, you're going to get a lump sum and you're going to have to ration care, because if you go beyond the lump sum, you're going to eat the difference. Back to the editorial. Unfortunately, the details of this massive change, necessitated by skyrocketing costs and the desire to improve quality, are completely unspecified by the Commission, although a new Massachusetts state bureaucracy clearly will be involved. Now, what does that mean? Does bureaucracy ever make it quicker, better, higher service, better quality? I don't think so. Yet it's entirely unclear how much unspecified changes would impact physician practices and compensation. Hospital organizations and their capacity to invest and the ability of patients to receive the kind of quality of care they desire. In other words, we're not going to get the outcomes we want. Similar challenges would eventually confront the entire country on a more explosive scale if the current legislation becomes law. Selling an uncertain and potentially unwelcome outcome such as this to the public would be a challenging task. It is easier to assert confidently, but disingenuously, that the decreased cost and enhanced quality would result from the current legislation. Now again, what is the Dean of the Harvard Medical School telling you? He's telling you that the people who are arguing this is going to reduce cost and increase quality are at best disingenuous, most likely just plain dishonest. So the majority of our representatives may congratulate themselves on reducing the number of uninsured, while quietly understanding this can only be the first step of a multi-year process to more drastically change the organization and funding of healthcare in America. I have met many people for whom this strategy is conscious and explicit. Funny that they're not telling the voters that. We should not be making public policy in such a crucial area by keeping the electorate ignorant of the actual road ahead. Dr. Flier is the Dean of the Harvard Medical School. Now, I want to make a few closing comments on this. I am not a medical doctor. Dr. Flier is the Dean of the Harvard Medical School and a practicing physician. So the CBO has said that between 15 and 30 million people will remain uninsured after we spend $1.2 trillion. And by the way, that's the projected spending. If we have the same increase in cost that Medicare had, it will be between 6 and 12 trillion. So you might ask yourself, if we really want to insure everyone, why would we choose this particular bill? There are a number of problems with this bill. No tort reform to lower malpractice insurance. No provision for selling interstate policies in medical insurance. Currently, if you live in Massachusetts, you have to buy a Massachusetts policy. Competition among the 4,000 healthcare insurance firms that was national would lower the cost. Competition always does. Finally, I really want to point out that and again, the attack from the left on this is always, you're not qualified to make the argument. If you are qualified, you're outside the mainstream. And if you're qualified and in the mainstream, then you're obviously a paid lackey of corporate interests. The dean of the Harvard Medical School should be the gold standard for understanding what is going to happen if this bill passes. From a policy standpoint, from a standpoint of an educator in medical school who sees to it that we get new doctors every year, I think every person, every voter, every citizen should take to heart that Dr. Flier is giving you a huge warning here, and he's telling you that this will not work. He's telling you that the current debate is failing, and he would give it an F grade. So what we need to do from both sides of the argument is come forward with positive policies that would make positive changes. And I would urge you in your postings this week, again, a little cry for civility here, I don't want to hear that Dr. Flier is not qualified to comment on this, or he's outside the mainstream, or he's a paid lackey of corporate interest. What I want to hear is specific factual support or specific factual denial of what he's made as an argument. He's saying the current bill as scored by CBO won't insure everybody. He's saying that it won't lead to an increase in the quality of medical care, and he's saying it'll lead to a national disaster. Beyond that, he's saying that both sides of this argument are being hyperbolic and disproportionate in their commentary. So let's have a nice debate, factually based on whether or not healthcare, as it's currently constituted in the House bill, and there's 5 different bills going through the Congress right now, but let's have a debate as citizens about which would be best for us and our families. And let's talk in terms of the total cost, not the 1.2 trillion proposed, but the 6 to 12 trillion will most likely really cost. Alrighty, it's been great to visit with you, and we'll come back to this subject again and again. Extend freedom, extend liberty, enjoy your rights, read your Constitution. Have a great week. We'll see you next week. Bye-bye.